Most people have no idea how often lung cancer is missed until it's too late. The scary part? Many early symptoms look completely normal. People assume it's just tiredness, stress, or a simple cough. But ignoring these small signs is exactly why lung cancer remains one of the deadliest diseases in the world. In this video, we'll look at the 13 early warning signs you should never overlook. These symptoms can appear weeks or even months before the disease becomes severe, but most people never recognize them. Just imagine this. If you understand a few key symptoms today, you'll know whether you're safe or if you need medical attention. Stay with me until the end, because by the last symptom, you'll be able to say with confidence, "I'm safe," or "I need to get checked." And yes, the last symptom is something 99% of people ignore. And this one sign alone is the reason so many lung cancers are detected late. Before we start breaking down the 13 symptoms, there's something important you should know. Many of these signs can also appear in other common health conditions. That's why it's crucial to stay with me till the end, because I'll also explain which symptoms are extremely serious and which combination of symptoms means you should see a doctor immediately. Before we begin, tell me in the comments, what's your name? Where are you watching from? And which symptom worries you the most? I read every comment, and I'll guide you with the right information. If you find this video helpful, make sure to like and subscribe for more life-saving health tips. Alright, let's get started with the first sign. Number 1. A persistent cough. A long-lasting cough is one of the earliest signals your lungs give when something is wrong. This happens because lung cancer often starts by irritating the delicate lining of the airways. When a small tumor forms, it disturbs the normal airflow and triggers the body's natural response, a continuous cough. In the beginning, this cough can feel harmless. Most people think it's just a seasonal cold, allergies, or irritation from smoke or pollution. But the key difference is this: the cough doesn't go away. It stays for weeks, sometimes even months, and slowly becomes more noticeable. Over time, the cough may change in a few ways. It may become deeper, more painful, or more frequent. Some people notice they cough more during talking, exercising, or at night while trying to sleep. Others feel a slight tightness in the chest that they never felt before. The biggest problem? People ignore this symptom because it feels so common. They keep telling themselves, "It's just a minor infection, my throat is dry," or "It will get better on its own." But when a cough lasts longer than 3 weeks without any clear cause, it's a sign you shouldn't overlook. A persistent cough doesn't always mean cancer, but it can be your body's first early warning. Recognizing this change early gives you the best chance for timely testing, early detection, and better treatment outcomes. Number 2. Coughing up blood. Even a small amount of blood in your cough is a serious red flag because it means something inside the lungs is damaging the tiny blood vessels that help you breathe. When a tumor grows near these airways, it can irritate or break the delicate tissues, causing streaks of blood to appear in the mucus. This doesn't always look dramatic. Sometimes it's just a light pink tint, a few red spots, or a rusty color mixed with phlegm. Many people ignore it or convince themselves it's from a sore throat or brushing too hard. But blood from the lungs has a very different pattern. It often comes with a warm, metallic taste, or a sudden feeling that something burst while coughing. You might see it once and then not again for days, making it easy to dismiss. But even a single episode is worth paying attention to, because bleeding inside the lungs usually means the airway lining is under stress, inflamed, or being pushed by something abnormal. As the condition progresses, the amount of blood can increase, or the coughing episodes can become more frequent. Coughing up blood is never normal. It doesn't matter if you smoke, have allergies, or recently recovered from an infection. The lungs should not bleed. This symptom needs immediate attention, because early investigation can help find problems at a stage when treatment is far more effective. Number 3. Shortness of breath. When lung cancer starts affecting the airways or lung tissue, the lungs lose the ability to expand fully. Even a small tumor can narrow the passages where air moves, making each breath feel less satisfying. Over time, you may notice that normal activities, walking, climbing stairs, carrying groceries, suddenly feel harder than before. This symptom often begins quietly. You might feel a slight breathlessness only during physical activity, but as the irritation or blockage grows, the lungs struggle to bring in enough oxygen, and you may start feeling winded even while resting or talking. Shortness of breath doesn't always feel dramatic. Sometimes it shows up as a tight chest, a feeling that you can't take a deep breath, or a sensation that the air isn't reaching the bottom of your lungs. Some people describe it as breathing through a narrow straw, or like something heavy is sitting on their chest. What makes this symptom concerning is how gradually it can develop. Most people blame it on aging, weight gain, lack of fitness, or stress. But when breathing becomes noticeably harder without a clear cause, it's a sign the lungs are under pressure from something inside. Breathing is one of the body's most automatic functions. You never think about it until it becomes difficult. And when lung function begins to drop, your body tries to compensate by breathing faster, which makes the shortness of breath even more noticeable. Paying attention to these early changes can help catch lung problems long before they reach an emergency level. Number 4. Chest pain. Lung cancer can cause discomfort in the chest when the tumor presses against nerves, the chest wall, or the lining of the lungs. This pain is very different from muscle soreness or heartburn. Instead of a surface-level ache, it feels deeper, inside the ribs, behind the breastbone, or in one specific area of the lung. The pain can range from a dull pressure to a sharp, stabbing sensation that appears during breathing or coughing. Some people feel it only when they take a deep breath, while others notice a constant heaviness that refuses to go away. In many cases, the pain spreads to the back or shoulders, making it harder to pinpoint the exact location. What makes chest pain linked to lung cancer unique is that it often worsens with movement of the lungs, like deep breathing, laughing, or even sneezing. This happens because the tumor irritates the pleura, the thin two-layer membrane around the lungs, which is packed with sensitive nerves. Many people mistake this pain for muscle strain, acid reflux, or stress, especially when it comes and goes. But lung-related chest pain usually stays persistent or slowly intensifies over time. Any unexplained chest discomfort should never be ignored, especially if it's new, persistent, or unexplained by injury or exercise. Your chest protects some of the most vital organs in your body, so pain in this area is one of the clearest signals something deeper needs attention. Number 5. Unexplained weight loss. When lung cancer begins to grow, it quietly changes the way your body uses energy. Even before any major symptoms appear, cancer cells demand constant fuel to grow and multiply. This forces your body to burn calories much faster than normal, even when you're resting or doing nothing. At first, the weight loss may seem small. Clothing feels a bit looser, your face looks thinner, or the number on the scale drops without you trying. But over time, the weight begins to fall more rapidly, and you start losing muscle instead of fat. What makes this symptom confusing is that people often think it's due to stress, a busy lifestyle, or eating less. But with lung cancer, the weight loss happens even when your diet hasn't changed. Your appetite may stay the same, or you may feel full faster than usual because your body is struggling to process food efficiently. As the disease affects your metabolism, the body starts breaking down muscle for energy, leading to weakness and a noticeable change in physical appearance. Many people describe this type of weight loss as unplanned, strange, or sudden, because nothing they do explains it. Unexplained weight loss is not just a cosmetic issue. It's one of the body's strongest signals that something serious is happening internally, especially when combined with other lung-related symptoms. When the body loses weight without effort, it's time to take a closer look at what's happening beneath the surface. Number 6. Fatigue or persistent tiredness. This isn't normal tiredness that improves with rest. Lung cancer-related fatigue feels heavier and more draining, as if your body is constantly running out of energy. Even simple tasks, getting out of bed, walking across the room, or concentrating on a conversation may feel unusually difficult. This happens because cancer affects the body in several ways at once. It produces chemicals that interfere with your energy levels, reduces the amount of oxygen your lungs can deliver, and places extra stress on your immune system. As a result, your body is working overtime, even when you feel like you're doing nothing. Fatigue from lung cancer often appears long before a diagnosis. You may sleep normally but wake up exhausted or feel tired at unusual times of the day. Some people describe it as a whole-body tiredness, a deep, heavy fatigue that doesn't go away with rest, food, or sleep. What makes this symptom tricky is that it's easy to blame on life, work pressure, aging, poor sleep, or emotional stress. But when this tiredness becomes constant, unexplained, and out of character for you, it's a sign your body is struggling to keep up. Persistent fatigue isn't a minor inconvenience. It's your body telling you that its energy system is being disrupted from the inside. Recognizing this change early can help uncover lung problems long before they become severe. Number 7. Loss of appetite. Lung cancer can quietly affect the way your brain and stomach communicate. Even before major symptoms appear, the body releases certain chemicals in response to the cancer, and these chemicals interfere with hunger signals. As a result, food becomes less appealing, and you may stop feeling hungry at the usual times. This change doesn't happen suddenly. At first, you might skip a meal here and there, or feel full after eating only a few bites. Over time, even your favorite foods may no longer taste or smell the same. Some people describe it as not feeling interested in food, even when they know they haven't eaten enough. What makes this symptom concerning is how quietly it develops. You may not notice the pattern until someone points out that you're eating less. And because the body isn't getting enough energy, it starts affecting weight, strength, and overall mood. Loss of appetite isn't just about eating less. It's a sign that your metabolism and internal balance are being disrupted. When this change appears along with other lung-related symptoms, it becomes an important clue that the body is under stress and needs attention. Number 8. Recurring infections. Lung cancer can weaken the body's ability to fight off common illnesses, especially infections in the chest and airways. As a tumor grows, it can partially block air passages, allowing mucus to build up. This trapped mucus becomes a perfect environment for bacteria to grow, leading to frequent infections. These infections often show up as repeated cases of bronchitis or pneumonia. You may recover for a short time, only for the cough, fever, or chest discomfort to return again. Some people take antibiotics and feel better temporarily, but the symptoms come back because the root cause, the blockage or irritation in the lungs, is still there. Another warning sign is when infections take much longer to heal than they used to. What used to clear up in a week may now take weeks, or may never fully go away. This happens because the immune system is under pressure, and the lungs are struggling to stay clear. Recurring infections are not random. When they keep returning to the same area of the chest, or happen more often than usual, it's often a sign that something deeper is interfering with normal lung function. Paying attention to this pattern can help catch problems early, before infections become more severe. Number 9. Hoarseness. A sudden or persistent change in your voice can be an early sign that something inside the chest is putting pressure on the nerves that control your vocal cords. One important nerve, called the recurrent laryngeal nerve, runs from the brain down into the chest and back up to the throat. When a tumor grows near this nerve, even slightly, it can interfere with its function, causing your voice to weaken or sound different. Your voice may become a bit rough in the morning, slightly deeper, or unusually breathy. At first, people assume it's due to dryness, shouting, or a mild throat infection. But the key warning sign is hoarseness that lasts more than 2 weeks without any cold, fever, or infection. As pressure on the nerve increases, the vocal cords can't move properly. This may cause the voice to crack, fade out mid-sentence, or feel weak even when you try to speak loudly. Some people notice that talking for long periods becomes tiring, or their voice loses its clarity and sounds strained. You may not even recognize the change until others around you ask, "Why does your voice sound different?" That outside observation is often the first clue something is off. Hoarseness linked to lung cancer is not about the throat itself. It's about what's happening deeper inside the chest, when the voice changes without a clear cause, and especially when it stays that way. It's the body's way of signaling that something is interfering with the nerves responsible for speaking. Number 10. Wheezing. Wheezing is a soft, high-pitched whistling sound that happens when air struggles to move through narrowed airways. With lung cancer, this narrowing can happen when a tumor presses against the tubes that carry air in and out of the lungs. Even a small amount of pressure can reduce the space for air to flow, creating that whistling or squeaking noise when you breathe. Unlike asthma or allergies, which usually come with clear triggers like dust, exercise, or cold weather, cancer-related wheezing often appears without any reason. You might notice it while lying down, during light activity, or even while resting quietly. Wheezing may start subtly. At first, it might be a faint sound only you notice, but over time, it can become louder and more consistent. Some people describe it as a tight feeling, like the air is getting trapped inside the chest. Others say it feels as if the lungs are working harder than before, even for simple breaths. What makes this symptom important is the pattern. If wheezing appears suddenly in someone who has never had asthma, or if it keeps returning despite treatment, it's a sign that something is physically obstructing the airway. Wheezing isn't just a breathing noise, it's a message from your lungs that airflow is being restricted from the inside. And when there's no obvious cause, it becomes a warning that should never be ignored. Number 11. Swelling in the face or neck. This symptom happens when a tumor in the upper part of the lung presses against one of the major veins in the chest, the superior vena cava. This vein is responsible for carrying blood from the head, neck, and upper body back to the heart. When it gets partially blocked, blood flow slows down, causing visible swelling. The swelling usually starts gently. You may notice puffiness around the eyes in the morning, a tighter feeling in your face, or a slight tension around the neck area. Over time, the swelling becomes more noticeable and may be accompanied by visible veins on the chest or neck. Some people also feel a sense of fullness or pressure in the head, difficulty putting on necklaces or tight collars, or a flushed, reddish appearance around the cheeks. Because the blockage affects circulation, bending forward or lying down can make the swelling feel worse. What makes this symptom serious is that it points to a major vein being compressed, something that doesn't happen in normal conditions like stress or dehydration. When the blood can't return smoothly to the heart, it creates a buildup in the upper body. This type of swelling is a strong indicator that something inside the chest is taking up space and interfering with the normal flow of blood. Recognizing it early can prevent complications and help identify lung cancer before it spreads further. Number 12. Finger clubbing. Finger clubbing is a subtle but powerful warning sign that many people overlook. It happens when the tips of your fingers become rounder, wider, or more swollen than normal. The nails may also curve downward, giving the fingers a smooth, bulb-like appearance. This change happens because lung cancer can reduce the amount of oxygen reaching your bloodstream. When the body senses low oxygen for long periods, it sends extra blood to the fingertips in an attempt to compensate. Over time, this increased blood flow causes the tissues around the nails to thicken and reshape. Clubbing develops gradually, which makes it easy to miss. You might notice your rings feeling tighter, your fingertips looking more puffy, or your nails losing their normal angle. Some people describe it as their fingertips looking shiny, or the nails starting to grow in a curved shape rather than straight. What makes this symptom particularly important is that finger clubbing rarely happens for simple reasons. It's strongly linked to serious lung conditions, especially those that affect long-term oxygen levels. And because it's painless, people don't usually pay attention to it until the change becomes very noticeable. If your fingertips start changing shape without any clear cause, especially if it's happening slowly over weeks or months. It's a sign your lungs may not be delivering oxygen the way they should. And this symptom is one of the most ignored signals of lung cancer, even though it can appear early. Number 13, difficulty swallowing. This symptom appears when a lung tumor grows large enough to put pressure on the food pipe, the esophagus, or nearby nerves. As that pressure increases, swallowing solid foods, and sometimes even liquids, becomes harder and more uncomfortable. The change doesn't happen suddenly. People usually start by feeling like food moves down more slowly, or that it gets stuck in the throat or chest. Over time, swallowing may cause mild pain, a burning sensation, or the need to drink water just to help food pass. Sometimes the difficulty comes from something called compression, the tumor pushing against the esophagus from the outside. Other times it's due to irritation or inflammation inside the chest. Either way, the food pathway becomes narrower, making swallowing more effortful. This symptom is easy to dismiss. Many people think it's acid reflux, eating too fast, or simply not chewing well. But when this problem keeps returning, especially if it gets progressively worse, it often signals that something deeper in the chest is affecting movement and space. Difficulty swallowing doesn't just affect eating. It can lead to weight loss, discomfort during meals, and even fear of choking. And because swallowing involves multiple nerves and muscles, any problem here is a sign your body wants you to pay attention. This is one of the symptoms 99% of people ignore, even though it can be directly linked to advanced lung pressure inside the chest. If you noticed any of the symptoms we discussed today, even if they seem mild or come and go, please don't ignore them. Lung cancer often stays silent until it becomes serious, and early detection can make a life-saving difference. Your body speaks in signals. A persistent cough, trouble breathing, changes in your voice, unexpected weight loss, unusual fatigue. These are not things to overlook. You deserve answers, and you deserve peace of mind. So if something doesn't feel right, talk to a healthcare professional. A simple checkup, a scan, or even a basic examination can give clarity and potentially catch a problem before it becomes dangerous. Remember, awareness is the first step. Action is the second.